Hello, my name is Jay Huang. I'm a junior attending pathologist. I recently passed my boards, yay! And I go over cases almost on the daily from head to toe. So if you're interested in that, consider giving us a like and subscribe. Without further ado, thank you to Path Library for this case. Here we have, well, let's look at the clinical info. A 55-year-old female, axillary sentinel lymph node excision for melanoma. Okay. So when you get lymph nodes and it's for sentinel lymph node, look for metastasis. You want to look for right under the capsular space because that's where the metastasis tend to lurk. It is a bit difficult differentiating sometimes the epithelioid histiocytes and that cytokeratin stains, which will be positive for metastatic carcinomas, would help. In this case, cytokeratins wouldn't help because this is melanoma. It's not an epithelial tumor. But here we have in the capsule bland epithelioid looking cells with grayish cytoplasm, and they're within the capsule. They're not facing the lymph node architecture here. So this could be either metastatic melanoma or a capsular nevus. But the bland nature of these cells more or less looks like a capsular nevus. So special stains, SOX10 will be positive, S100 positive, HMB45 should be negative. So I'm curious why it was positive in the cells of interest, maybe weak positive, and melon A positive. But HMB45 can help you differentiate a capsular nevus versus a metastatic melanoma. It should be positive in metastatic melanoma. So this is capsular nevus. Within the capsule of the lymph node are two different areas populated by small, fairly monotonous round cells with grayish cytoplasm. There's some degree of nesting. At this point, the differential diagnosis between metastatic melanoma and capsular nevus. Features favoring nevus in this case are the location of the cells within the fibrous capsule, as opposed to it being within the subcapsular sinus, which would be where metastasis generally occurs, as well as the bland cytology and lack of prominent nucleoli. So capsular nevi represent hematogenous but non-malignant spread of melanocytes from benign nevi. This phenomenon mainly occurs in axillary lymph nodes, and the main differentiating factor between metastatic melanoma and capsular nevus are location and cytology. So hope you enjoyed this case. Again, I find it interesting that the HMB45 was positive in the capsular nevus. But I assume it was like a very weak positive. But otherwise, we talked about capsular nevus, and I'll talk to you next time. Thank you for watching. Bye.